Hello everyone, welcome back to our YouTube channel. I hope you are enjoying the videos. For more insight on HR practices and real corporate world exposure, please subscribe to our channel, like the video and do share it with others. Also, please press the bell icon to never miss an update from HR Success Talk. Thanks a lot. Enjoy this video.
Hello everyone, my name is Tanvi Kotin and I work in corporate sales at Dhani Healthcare. Today I have with me Dr. Smita Dash. Dr. Smita Dash is CMO at Dhani Healthcare and has overall responsibility for clinical and diagnostic services. She is a family physician and public health specialist, having also worked for several years in developing NICE clinical guidelines for the NHS in the UK, in addition to her clinical practice. Today, she'll be talking to us about COVID-19. Over to you, Dr. Smita.
Thank you, Tanvi. Hello, everybody. Pleasure to be with you. Like Tanvi mentioned, today we will be discussing about COVID-19. Before we move on to the topic per se, I'd just like to take a few moments to introduce the Dhani Doctors team and what we do at Dhani Healthcare. So we are a telemedicine organization. We have basically our Dhani Healthcare Service, which includes the Dhani Doctor platform, in-house diagnostic services across India, as well as all India medicine delivery services. Specifically with regards to our Dhani Doctor team, we have over 200 doctors and they are available for video consultations when you download the Dhani app. You can access or speak to a doctor. They're available 24/7. We have over 20 different specialties of doctors whom you can speak to. And our doctors are based across India, so they speak a lot of different languages. So that's very helpful to our patients. We've been rated consistently very highly by our patients, and our patients remain very happy with us. So should you have any concerns, any health-related issues, please do reach out to any of our doctors. People often ask us what other specialties do we have at Dhani. So you can if you were to go onto the app, you would be able to sort of see all the doctors listed there and their experience, their background, what specialties they are from. Over a broad overview, we have family physicians, we have general medicine physicians, we have people specializing in diabetes and cardiology, we have gynecologists, gastroenterologists, ENT, eye, people specializing in COVID care, chest medicine, pathology, in mental health. So the list is quite large, and should anybody want to speak to a specialist, they're very welcome to reach out to any of our doctors here at Dhani. So now moving on to COVID-19 with that brief introduction behind us. So COVID-19, as we all know, has been plaguing the world for a very long time now. It's been over 1.5 years, and people continue to get affected. There are daily we hear of cases going up. So what do we know about it? We thought that it would be a good time to just take stock of where we have come so far, what we know about the illness. As we've sort of moved from last year, from when it started till now, and to understand what are the things we could do to prevent it, how we take care of ourselves. So it's a broad overview about COVID-19 and what we've learned so far. So we know that it's an infectious disease. It's caused by the SARS-CoV-2 virus. It was first identified in China in December 2019. Following that, there was rapid spread across different countries, so much so that it led the WHO to declare it a pandemic in March 2020. Now, initially, it was thought to be a lung disease, a pulmonary disease, but now over time we know that it is not so. It is actually a hyperinflammatory vasculitis, in that it affects different blood vessels within the body, and it also is a condition wherein the risk of blood clots is quite high. So in medical parlance, we call that thromboembolic events. We've seen that the infection has come in different waves across different countries. So there have been cases wherein the numbers have been rising in their first instance. Then there has been a period when there has been a lull, and the numbers have come down. And then subsequently, again, the numbers have risen with increased virulence. Currently, if we're talking about India, we're in the throes of a huge second wave, which has turned out to be much deadlier than the first time this disease was identified in India. Brief look at the statistics. So as on 30th May, those are the statistics. Those are the numbers that, there were. So there were 16 crore 95 lakh 97,000 odd confirmed cases with 35 lakh 30,582 deaths. And there were basically, those are the numbers for the vaccines administered, and that's on 26th May. So we'll send the presentation around. You can have a look at the numbers. When we're talking about India, from 3rd Jan 2020 to 30th May 2021, we have over 2 crore 78 lakh 94,000 odd cases with 3 lakh 25,972 confirmed deaths. So a really huge number. And something that is a sobering thought as to why we need to deal with this as stringently as we should. The statistics are taken from the WHO website, and as you can see, they were last updated on the 30th May. So things may have changed in the last day or so. Now, a lot of people we have been hearing about different variants of this virus come up, and there are reports of different variants of this cropping up in different countries. There are concerns regarding whether something is more transmissible, whether it is more dangerous. So what are these variants? Now, variants are different forms of the same virus. They undergo a mutation, and they can be present in different forms. So when it was, since the time that it was initially isolated, which was in December 2019, after that there was an early mutation that took place and quickly replaced the original strain. So we had a first strain that came on during around Jan-Feb 2020, and that replaced the original strain and became the most dominant strain. Since then, going forward, there have been different strains that have been identified across different countries. So we've had, these strains were originally named according to the places they were identified from. There is basically a number that is allocated to these strains for a very specific scientific name allocated. However, it's much easier to actually, call or give them the names from the places they were identified. The WHO has since thought this through again, and has developed a strategy wherein these strains will now not be identified by the place they were isolated, to avoid stigma to those places. So we have the new WHO labels which refer to the original strain. So the strain that was identified in the UK in September 2020 is now called the Alpha strain. The one that was identified in South Africa is called the Beta strain. There was a strain identified in Brazil in November 2020, that's the Gamma strain. And there's a strain identified in India now, which is a variant of concern, which is the Delta strain. Now, these 4 strains have been identified as variants of concern. And what do these variants of concern mean? So a variant of concern is identified as one which shows an increase in transmissibility in comparison to the original, variant identified, or there is an increase in virulence. Virulence refers to how dangerous the virus is, how much it can infect other people, or if there is a change in the clinical disease presentation from before. So if that has changed over time, then it is a variant of concern. We know that the virus itself is changing, and the way it presents in different people is also changing. And what is actually the thing that we need to know about these variants? So the bottom line is that every virus, throughout its life cycle, throughout the cycle that it goes through, does tend to mutate, does tend to produce a lot of variants. And these variants, they come about when the virus spreads more and more. So when a virus is spreading fast through large populations, then these viruses have the chance to actually multiply and to undergo these changes. So the bottom line, the message that comes from seeing these many number of variants, or knowing that a virus is mutating more and more, as for the general public, the message is that if we avoid the spread of the virus, the mutations can also come down. We give the virus a less chance to mutate if we curb the spread of the virus, if we prevent the virus from spreading. So these are the 4 variants of concern. We also have 4 variants of interest. And these were again identified in different countries, but according to the new WHO labeling, they're now labeled, with different Greek alphabets. So that's how they will come to be known in for future reference or for future use. A little bit more about about the virus itself. So we know that it takes 2 days to 14 days for the infection to from the time of infection to when the symptoms appear. So this is called the incubation period. So it can take from 2 to 14 days, but usually we see that the symptoms come within 4 to 5 days. So again, what is the message to take away from knowing about this incubation period? The important thing is to know is that as soon as somebody suspects that they might be exposed to somebody who is COVID positive, or they have contracted the infection in any way, it's important for them to actually isolate themselves, to quarantine themselves till the infection is confirmed. If it is confirmed, obviously they continue to isolate. So prevention of spread is as important as treatment over here, and these are the things that we learn from all the different scientific aspects that we pick up from the virus. Who are the different risk groups who may go on to develop severe illness? So we know that elderly people who are over the age of 60 are more at a higher risk. People with underlying medical problems. So for example, people with heart disease, or people with stroke, or people with lung disease or kidney disease, or people with chronic conditions like diabetes or blood pressure or asthma, which are not well controlled, people who are immunocompromised, receiving chemotherapy. These are the people who may go on to develop severe illness if they are affected. So those are groups that we as doctors also look out for, and we encourage people to also sort of keep these vulnerable people in mind and be extra cautious with them. One other thing that we have seen is people who tend to have high BMIs, people who are obese, are also prone to have much more severe disease outcomes. So what are the symptoms and signs in COVID-19? So from the beginning, we knew, there are a few typical symptoms that come across. So like fever, dry cough, people may present with tiredness, fatigue, there can be body ache, there can be headache. Some people may present with sore throat, nasal congestion, so upper respiratory symptoms. They can have chest tightness. They can have breathlessness. Breathlessness is usually a sign of severe illness, but in some cases, people can present with that. Loss of smell or taste sensation has also been found to be associated very strongly with coming positive for COVID-19. Since the last time, so these symptoms were present in the beginning, they continue to be present. And as the virus has mutated, as new strains have come in, the course of the illness, the presentation of the illness has also changed. So we have since found that people are also presenting with stomach pain or nausea, or diarrhea or vomiting, or there's redness in the eyes, or there's congestion. So these are also atypical symptoms that people are presenting with. Some people in a severe illness can present with mental confusion. So all of these things can be signs of COVID-19 and need to be taken very, very seriously. Again, very, very importantly, some people can present with no symptoms at all. They can be completely asymptomatic. But if we know that these people may have come in contact with people who were COVID positive, if they have been at risk of contracting the infection, it's very important to test them to find out if they have contracted the infection, and also to isolate till things are confirmed. So what are the diagnostic tests we use to diagnose COVID-19? So as of now, we know that RT-PCR test is the gold standard test. So we have, the nasopharyngeal and the oropharyngeal sampling. So swabs are taken from the nose and from the throat, and these detect the, virus RNA, and are gold standard tests for detecting COVID-19. We also have the rapid antigen tests. These are also nose and throat swab tests. These are cheaper. They offer, the results are available much more quickly, but they're less accurate than the RT-PCR. So while they're less sensitive at picking up, the infection, it is important to realize that, there is very less chance of these tests also coming false negative. While there might be, they might tend to miss some cases because of low sensitivity. Definitely when, a test is positive, it is positive and should be taken. So, they are quite specific to that, and they do pick up, the tests are quite specific and will pick up an infection. If they're positive, then it is definitely a positive case. One very important thing to note is that if the RT-PCR test is negative, and yet, there is a high suspicion that the patient might be COVID positive, one needn't say that, okay, one can say the test is negative, but one will still proceed to treat it as a COVID. So one can diagnose based on clinical features, on different blood tests. So we call them serum markers of inflammation, and we can look at, CT scans of the chest and chest X-rays, and a diagnosis can be based upon these tests, even if the RT-PCR test is negative, and the treatment follows the same protocol. So what are the things that doctors look for when we find a test, when we find a case of COVID positive patient? So when a patient comes to us and tells us that, my report for COVID has come positive, what do we do as doctors? Just to give you a very brief idea. So first of all, we assess the patient's condition. We assess where they are in the course of their illness, how they're doing, and we try and classify the patient whether, it is a mild case, it is a moderate case, it is a severe case. And we try and do this on the basis of different criteria. So say, for example, the patient has a very high respiratory rate, or their oxygen saturation is not being maintained above 94% at room on room air, or they're done a chest HRCT chest, and then there is more than 25% involvement in each lobe of the lung, then we would classify that case as a moderate case, and that case would then be referred to hospital. Obviously, we look for also other blood tests and inflammatory markers, and I've not listed them here because not everything is done in every patient. So the primary thing that is first done is a clinical examination, a clinical assessment to find out, where they are with respect to, the symptoms they're having, the signs they're having, how poorly they are, whether they have body ache, headache, what are their, and then we look at their inflammatory markers. So we might look at tests like, CBC or CRP, which is your C-reactive protein. We might look at factors of coagulation, so, to check whether your blood is thickening. And accordingly, we make an assessment of whether the patient is a mild case or a moderate case or a severe case. If, we assess the case is a moderate case or a severe case, the guidelines state that we have to refer them to hospital for admission, and they receive treatment over there. There is no treatment for a moderate or a severe case at home. They are ideally referred to the hospital, and treatment treatment then sort of continues on from there. If it is a mild case, the guidelines state that they can be assessed and they can be treated for at home. So when we have, after having assessed the patient, with respect to their clinical condition, their pathology tests, their radiology tests, we come to the assessment that this is a mild case, then we make the judgment that, okay, this person can be treated at home, and we follow through on that. We advise the patient that, you will have to go into isolation at home, and then we start to treat them at home. Even this is done taking other criteria. So it's not just that, the case is mild. We also have to figure out whether the patient can be treated at home. There has to be proper isolation facilities. They have to have a room to themselves. They should not be at risk of spreading the infection to other people while they are at home. One has to factor in whether there are other vulnerable people around at home. So all of these factors need to be taken into account, and then a decision is come wherein you advise, okay, this person is fit for home isolation and treatment at home. So I'll be talking a little bit about the management in home quarantine. So one thing to remember is that treatment, when it is done at home, is always done under the physician's supervision. So even if it is a mild case, or it is it is an asymptomatic case, or even if there are mild symptoms, the treatment, if a patient is being followed up at home, they have to be under the supervision of a physician. Often we see, because of the number of cases that are burgeoning, we see people saying that, yes, I have got a few symptoms, I'll take a few medications that are available, and I'll just isolate myself, and that's fine. That's not the correct thing to do. What we have learned about this illness over time is that it can change its course quite quickly, and things can go downhill very, very quickly. So it's very important for someone to actually be monitoring people at home, to monitor their clinical signs and symptoms, to monitor their clinical condition, their vital parameters, so like their pulse, their temperature, their oxygen saturation, their respiratory rate, their blood pressure. So all of these things need to be monitored. Everything needs to be considered, all put together, and they have to be monitored and assessed periodically. And if there is a deterioration in signs and symptoms, then obviously a decision has to be made whether home isolation can continue or it cannot continue. So what I mean is, if a decision is made at the beginning of a person's treatment that this is a case for home quarantine, it need not necessarily remain the same for the entire course of the illness. Hence, it is very important to stay under a physician's supervision. Once they are being supervised by their physician, they can continue to take their medications. If they are taking any other medications for any other illness, they will obviously have to be speaking about that to their physician, but and continue with their medications. Some medications might need to be stopped. So say, for example, we find that patients who are taking medications for blood pressure, sometimes their blood pressure, because of the weakness, their BP starts to drop. And that's why it's important to assess all of these things. And, their physician can then take a call to stop their blood pressure medication for, a little bit of time. I'm just giving an example. Please do not stop your BP medications without your physician's advice or, checking it. But these are things that need to get taken into account. As part of management at home, hydration is very, very important. So drinking plenty of fluids, plenty of water. Rest, it cannot be overemphasized. As with any other viral infection, rest is crucial even in the recovery from COVID-19. So that's very important. And good balanced nutrition remains a cornerstone of recovery everywhere. So hydration, rest, nutrition. There's no specific diet to be followed. You can have normal food, but nutritious food, a well balanced diet, proper rest, and drinking plenty of fluids. Your doctor, if one is having fever, then antipyretics like paracetamol can be prescribed for bringing down the fever. You might be prescribed vitamins and mineral supplements. You might also be prescribed other, sometimes antibiotics are prescribed if there is a suspicion of a secondary bacterial infection. They have no role in any in combating the virus. But if a secondary bacterial infection is suspected, then you might be prescribed a course of antibiotics as well. We hear a lot of things about, different therapies, like, people reaching out for remdesivir, or people reaching out for other medications, or, do I need them, or, they go about looking for it, or I need this medication. So very, very important to understand that the decision to administer remdesivir or any other higher therapy is done only in a hospital setting. These cannot be administered at home. These are available only to be prescribed in a hospital setting, and that is where they are given. So I would urge everybody to not attempt to procure, or administer remdesivir or any other therapy which your doctor has not prescribed at home. This goes also for steroids. We are seeing a lot of cases wherein, patients come to us, and this comes because of self-medication, where patients have, taken medications, but then, they will speak to say, other people who, their neighbors or somebody might advise them and say, okay, I took this and I got better, and, people start steroids as well. Steroids have a role in the management of COVID-19, but there are very, very specific indications about where they should be started. They need not, they should not be started in mild cases. So and definitely in mild cases, even if they're symptomatic, but less than 7 days, steroids should not be started. Steroids are prescription medications and always should be, should be started only under the prescription of your doctor. Please do not start steroids by yourself. Like I said, there are very specific cases and indications where these need to be started. There are inhaled steroids, which can be started on prescription of your doctor at home. If you're in home quarantine and, things that there are symptoms and you're not getting relief, then, your doctor can start you on that. But again, please do not self-medicate. Please do not take any medications without consulting your doctor. Definitely not steroids. So what are the red flags or warning signs that somebody who is at home needs to look out for? So, a person who is under home quarantine is doing fine. What are the things they need to look out for? So there will be a monitoring chart that, your physician will advise you to look into, and that would include, 4-hourly recordings of your temperature, your pulse, your oxygen saturation, your respiratory rate, and also, they will look into how you're doing clinically. So, is the body ache increasing? Are you feeling more tired? So all of this monitoring will continue to happen throughout. Apart from this, if there are certain warning signs that everybody must know of, and if these occur, then, patients should reach out immediately. So say, for example, somebody has difficulty in breathing, or the oxygen saturation drops below 94% on room air, or they feel like, they're having chest tightness, or there's pressure in the chest, or, even mental confusion, when people are feeling, they're confused, they feel very drowsy, they feel like, they have to sleep off. These are things that should not be ignored at all and should be looked into right away. If these things are happening and you're on home quarantine, please raise it out to your doctor right away, and they will advise you accordingly. So when do we stop isolation? So a patient is discharged from home isolation after at least 10 days have passed from the onset of symptoms. So from the beginning of symptoms, after 10 days, one is eligible for, coming off the home isolation. After that, people are generally non-infectious. And if it is an asymptomatic case, so say the person had no symptoms from the beginning, then it's taken to be 10 days from the date of sampling for the RT-PCR test. So 10 days from there. And in both of these things, the patient should not have had fever for the last 3 days. So no other symptoms, no fever for the last 3 days, and 10 days have passed since the beginning of symptoms or from, the date of taking the sample for the test. Then one is eligible to come out of home quarantine or home isolation. Often we get asked, do we need to test again for RT-PCR after the home isolation is over? And the answer is no. There is no need to test again for RT-PCR unless and until there is a very specific reason. So say, for example, someone is traveling and needs a certificate for travel. then it is a different issue. But otherwise, after coming out of home isolation, there is no need for testing again. What are the precautions that one needs to take? And these are in general that we need to take to avoid getting the virus. So one is use of a mask. Please use a mask when you're stepping out, when you are speaking to people from you're not regularly in touch with. So please use a mask at all times. If you're out, then practice social distancing. Keep distance from people around you. Hand hygiene, so washing hands with soap and water, or using an alcohol based sanitizer if you don't have access to soap and water at that point in time. So respiratory etiquette, so covering your nose, covering your nose and mouth when you're coughing or sneezing with a tissue. So ideally use a mask, and that should help. But if you are without a mask inside the house, then do practice respiratory etiquette as well. As a general rule, try to avoid touching your face with unwashed hands. Please make sure that your hands are always washed and clean. And please do not come in contact with people who are sick. Even if, there's a lot of temptation, we reach out to loved ones, we want to reach out to friends. Please maintain your distance. These are difficult times. So avoid contact with people who are sick. If you're sick, then stay home, stay isolated, stay away from people. Frequently touched objects, they should be sort of cleaned frequently. They should be, disinfected. So surfaces like door handles, doorknobs, all of these things should be frequently cleaned. Take regular exercise, have a well-balanced diet, drink plenty of water. So, boost your immunity with all of these things. And if you notice any symptoms coming up, then please, speak to your doctor early. Please reach out early, because we've seen that, when treatment starts early, the chances of a good outcome are much higher. So normally we see that, patients who come to us later in the course of the illness, after having tried out a lot of medications, and we often see people who come at like the 7th day or the 10th day, and they have been self-medicating. Things do not look so good in such cases. So whenever you have any symptoms, if you're suspecting anything, please reach out to a doctor, speak to them, get help early. Very, very important. Please get vaccinated. So, the government has rolled out the vaccination plan. So please go ahead and get vaccinated, and that will help. So in addition to all the precautionary measures that we are taking to avoid getting the virus, getting vaccinated, helps us prevent the infection. So coming on to that, a little bit about the two vaccines that are available to us now. So here in India, we have two vaccines: the Covishield vaccine by AstraZeneca and the Serum Institute of India, and we have Covaxin. Shortly, there is going to be other vaccines also coming in. So the Sputnik vaccine, and there are talks of the Pfizer or Moderna as well coming in. They're not there yet, but we may see them. As of now, anybody above the age of 18 is eligible for vaccination. So Covaxin is manufactured by Bharat Biotech. So it's administered, both vaccines are given in 2 doses. Covaxin is given with 28 days between the 2 doses, between the first and second dose. And Covishield is also given in 2 doses, but they're given 84 days apart. So the rules have changed since vaccination was first rolled out, wherein initially it was 4 weeks apart, and then new evidence came in wherein the efficacy of the vaccine was shown to have improved when the gap between the 2 doses was higher. So now the vaccines are being given 84 days apart. Both are given in the arm. There are certain areas where, or certain conditions wherein it may be advisable to check if you should take the vaccine. So say, for example, one is allergic to the components of the vaccine, then obviously one should not take it. Now often people ask, how will I know I'm allergic to the components if I have not taken the vaccine? So one thing is that, if you've taken the first dose of the vaccine and you had a severe reaction, obviously please do not go on to take the second dose. The other thing is that if you've had an allergic reaction to a flu vaccine ever before, then it is a fairly good indication that you might be allergic to some of the waste products in this vaccine as well. So that is something to look out for. If one is having fever at the moment, or if one has compromised immunity, it might be worth holding back a little bit and then going back to take the vaccine once one is better. There are certain blood thinners wherein one will have to check with your doctor, and this is not that you should not take the vaccine, but check with your doctor before you take the vaccine in such conditions. There are a few questions that crop up regarding the vaccines, and we have been seeing these, across the board when patients approach us and ask us, about the vaccine. Should we take the vaccine? There was a general vaccine hesitancy in the beginning. People were concerned, and some doubts still persist. So the first thing that comes up is, are these vaccines safe? Do they have a lot of side effects? Now, one thing to note about any vaccine that is introduced to the general population is that it is introduced only after, regulatory bodies have cleared it based on safety and its efficacy. So large-scale clinical trials would have been done, and it would have demonstrated that these vaccines are safe to be given. And only then, these vaccines are rolled out to the general population. So yes, they're definitely safe. The side effects that you see with this vaccine are, the same that you would see with any other vaccine. There can be local pain. There can be, a little bit of fever for a day or so. So these side effects have been seen, but this is no different from any other vaccine that one might take. The next query that comes across is, are these vaccines efficacious? Do they actually work? And one of the things to know about these vaccines, about the COVID vaccines, is that the efficacy, they have been shown to have an efficacy of above 80%. Now, what does this mean? It means that in 80% of the cases, at least, these vaccines have been shown to prevent people from getting an infection. So that is very important. So in 20% of the cases, in people who have been vaccinated, you might still see them getting the infection again. But what is more important is to know that these vaccines, in all cases of people who have been vaccinated, they do prevent people from going into a severe state of the disease and preventing death. So that is very, very important. These vaccines are definitely known to prevent progression of the disease into a severe state and to prevent death. Now we hear a lot of stories wherein patients come to us and say, oh, they received the second dose of the vaccine, and then within a week or something, the patient really deteriorated and they had COVID, and things didn't go as they should have. Now, the important thing to know about these vaccines is the immunity level develops it takes at least 4 weeks after the second dose to reach the complete immunity. So even if one has taken the vaccine, there is a time frame. One cannot afford to be complacent after that. One still has to take the preventive measures. One still has to avoid getting the infection, because if you get the infection during that period, your immunity has not been built up by the vaccine. So there is still a chance that one might progress to a severe state. So 4 weeks after the second dose has come out, after the second dose has been taken, only after that the effect of the vaccine is there to the fullest, and that's when it has been shown to be efficacious. Both vaccines are efficacious and have been proven in different clinical trials. So that was a little bit about the safety and efficacy of these vaccines. Few questions that come up regarding vaccines, and this was just collated across different things. So one was, can very elderly people take the vaccine? So people in their 80s or 90s, and the answer is yes. Another thing was basically regarding people needing to stop their blood thinners before taking the vaccine. So normally, if people are on aspirin or things like ecosprin, they do not need to stop. If they are on very strong blood thinners, like say warfarin or acetrom, then do check with their cardiologist. Do check with your cardiologist. You might need to stop it for a few days on the advice of your cardiologist, take the vaccine, and then restart the medicine again. Can people, on chemotherapy or people who are taking insulin, can they take the vaccine? And the answer is yes, and they should take the vaccine. People who are diabetic, people, who are, immunocompromised, they need to take the vaccine. They are the at-risk groups and must take the vaccine. There's questions regarding, can asthma patients on inhalers take the vaccine? Should a person who's had COVID before, should they get vaccinated? And in both cases, the answer is yes. Another question that comes up is, if how long after an infection of COVID should they get vaccinated? So say a person has recovered from COVID, then normally 4 to 6 weeks after the recovery period, they can take the vaccine. So that is when they're advised that they can go ahead and take the vaccine. We've come pretty much to the end of the presentation. We've sort of just gone through what COVID is all about, what we can do to prevent, what a little bit about vaccines, and a few queries that we get regarding it. At the end, I'd just like to touch upon what we do at Dhani again. So we, for COVID, we have specifically kept aside free doctor consultations, which are available on our Dhani app. So doctors, you can consult our doctors 24/7. They're available 24/7 on the Dhani app. We formulated a home isolation package for patients with COVID, which will include dedicated follow-ups by a doctor over the period of home isolation. And I know I said that the period of isolation is 10 days, but to be on the safe side, we monitor patients for 14 days. And even beyond that, we are seeing post-COVID syndrome coming in. So it's not that at 14 days we stop and we do not check on you. One will go on, and if there are symptoms, you can be in touch with our doctors. Like I mentioned before, we also have diagnostic services. We reach out for, you can reach out to us for home blood collections, for investigations, for pathology investigations, and in certain places for radiology investigations as well. And we deliver medications and monitoring equipment. So for example, pulse oximeter, thermometers, can be delivered from our pharmacy section as well. So this was just a little bit about what are the things we have available from COVID home isolation perspective.